probably the most important piece of this is looking ahead as an employer about what's going to be the needs of our workforce as technology changes, as work changes, as systems change, and being able to have transparent conversations in the world of training and figure out how we best bring that education to the workforce so that meets both needs, that the employees can continue to grow and learn and progress in their career, and that we have the right workforce to make sure we provide good care to patients. So we're thrilled that the training fund continues to support us in that way.
How does it work? Like, your needs are changing pretty rapidly, I assume. How do you make sure that you're getting the employees you need and the skills you need?
So part of the great thing about the relationship with the training fund and this sector partnership that we have is we're in constant dialogue with the training fund sort of as the intermediary and with other healthcare institutions to identify what are the trends, and then with them to identify sort of specifically how do we create training to meet those needs, and so that when the training is actually developed, it's very customized to the sector needs. And for example, a course might be contextualized so that somebody's not just going to prepare for a course, but it's contextualized within the possibility of the field that they're going to go into. And so it's not just somebody going for their GED in a vacuum. And so that kind of conversation and the training fund with the resources that it has is very powerful in creating sort of a win-win for both the worker and for healthcare. For our institution.
Can you give an example, like around maybe the mental health workers? Or?
So there are tons of examples. One of the most powerful ones in the last year is the training fund came to us as healthcare employers and said, we see, like, really, we know that electronic health records is changing your industry. And we said, yeah, absolutely right. And they said, what kind of training do the employees need? And we were like, well, you know what? Honestly, this is the way we answered. We said, it's real, like, our vendors come in, the vendors who are putting in systems, they come in and train people. And the training fund really pushed back and said, it's more than that. We know the workers, they need more skills. We don't want people out on the street because of this. And educated us, so pulled together, did a symposium with educators and healthcare institutions, as well as the training fund, to really educate us into sort of the big picture of what this means. And as a result, Cheryl can say more about the program that came out of it with credentialing, so that was so great that actually now we as employers can look back on it and go, there's pieces of that when the vendors came and trained our people, we missed. So so that program has been developed, and we can now even pull pieces of it to use in areas that haven't been used. So it's that constant conversation and customizing to our needs, but they're the ones who identify what are the themes and pull in all the resources. Otherwise, frankly, we'd be just doing it on our own in a less